Hi folks, again welcome to another edition of Eat This Lose That program. This is another new video newsletter. On this video newsletter today we're going to talk about water, about drinking water, when to drink, why to drink and how to drink. That's one. And what to drink. Second, we're also going to talk about importance of fruits and the sugar in the fruits and fruit juices, why not to consume fruits and fruit juices. We'll also discuss about the drug of the week, which is going to be Metformin. What you need to know or be aware of Metformin. Once again, Ali is going to be moderating. So Ali?
Yes, sir, Dr. Reddy. So, everyone knows that water is essential to the human body. So could you give us your recommendation in regards to drinking water and, timing and stuff like that?
My kids go to school and I tell them one thing. When you get up in the morning, please drink water. Of course, being kids, and since they're my kids, they are not going to do what I ask them to do. But what I would recommend every one of us to do is get up in the morning and drink 2 glasses of water. How many glasses of water should I drink? Okay, anywhere between 8 to 10 glasses of water a day. Is it good to drink a lot more than that? It's not good to drink almost like a gallon or 2 gallons of water when it's not required. Of course, if you're working in the yard, if you're running, if you're working in conditions where the temperature is much higher, you're going to be sweating a lot more. And so in that scenario, you probably would end up needing more water. But on an average, if you're sitting in a room which is air conditioned and if you're not walking outside most of the time, if you're not a gardener or playing golf, then ideally the best thing for you to do is when you roll out of bed, drink 2 glasses of water. And every time you sit down to eat, drink 2 cups or 2 glasses of water, at least 8 ounces each. And if the food is salty, halfway through, drink 2 more cups of water. This way you tend to help yourself being fully hydrated and you will not have a problem with salt and water retention.
Okay, so you mentioned the second question, but is there a danger to drinking too much water?
Yes, drinking too much water is bad for you because if you end up drinking too much water, you're basically diluting your sodium in your body and you can run the risk of having a condition called hyponatremia. If your sodium level drops too low, you run the risk of damaging your brain if you try to correct it too quickly. Oh, wow. So, should I drink water? Yes. Should I drink a lot of water? No. Another thing is, as you continue to drink a lot of water, you start feeling lightheaded and dizzy. And if you start feeling lightheaded and dizzy or start having headaches, it's a sign that you've consumed a lot of water. So, once again, should I drink water? Yes. Should I drink a lot of water? No. If I drink a lot of water, am I going to have cramps in my legs? Yes. Am I going to feel lightheaded and dizzy? Yes. Am I going to have headaches? Yes. And is it all because of low sodium? Yes. And if your sodium level drops too low, am I at risk for hurting myself and damaging my brain irreversibly? The answer is yes. So, try not to drink too much water. If you start noticing cramps in your legs, if you start having lightheadedness and dizziness or headaches because of consuming a lot of water, the best thing for you would be to at least eat something salty or sprinkle some salt on your hand and lick it. That way you introduce salt into the system and try to recalibrate your sodium by consuming salt.
Makes sense. Okay, so on that note, do you think drinking plain water is sufficient, or are substitutes like electrolyte water, or vitamin water, and stuff like other fluids, can they take the place of water?
The best water to drink is tap water filtered. If not, then go for mineral water or spring water. But ideally, stick to plain water. Do not try to drink Crystal Light or other drinks which are substituted with sugar substitute or other flavors added to them. So, if you're asking what should I drink, drink plain water. Best is filtered water. What about juices? I would not recommend any juices, just water.
Okay, so just piggybacking off of the juices, the next topic is fruits. And a lot of doctors recommend, they have high recommendations when it comes to fruits. So what are your thoughts on that?
Every physician recommends eating fruits. Everybody wants to eat fruits and everybody likes eating fruits. Why do we like eating fruits? Because they're sweet. If you eat fruits, what are you getting? Sugar. Are they a good source of fiber and antioxidants? Yes, but you can also replace your fiber and antioxidants by eating a lot of vegetables. So, given a choice, should you eat fruits or vegetables? Eat more vegetables. Should I eat fruits once in a while? Yes. Should I eat fruits every time, 5 to 8 servings a day? I would say no, because I have patients who've been eating a lot of fruits and have come in and shown signs of adult onset diabetes. Once they give up fruits, I've noticed that their fatty liver tends to improve and their blood sugars tend to drop and their hemoglobin A1C also drops by merely eliminating fruits. Then the question is, why should I not eat fruits? Because you eat fruits because they're sweet. And the question you need to ask is, why are they sweet? They are sweet because they have fructose. And what causes diabetes? fructose. So if you are eating a product that has fructose, is it going to cause fatty liver? Yes. Is it going to raise your blood sugar down the road by causing diabetes? The answer is yes. So should I eat fruits? The answer is no. People say an apple a day keeps the doctor away. My statement is an egg a day keeps the doctor away and a fruit a day keeps the doctor in the neighborhood. So your choice. Should I eat an apple versus an egg? Eat an egg. I want nutrients, vitamins, eat an egg. What else? Vegetables. Eggs and vegetables give you more nutrients, vitamins and antioxidants than eating fruits.
Okay, so on the food pyramid, as we were growing up, it was always very high with 5 to 7 servings. So why do you think they were taught that in schools?
I have no answer as to why they recommend that, but this is what I've learned in my practice, and my recommendations are simple. If you want to lose weight, try not to eat fruits. If you want to prevent diabetes, try not to eat fruits. Should I eat fruits once in a while? Yes. If you have diabetes, should you be eating fruits regularly? No. If you do not have diabetes, can you eat fruits once in a while? Yes. But would I recommend eating fruits every day? No. Instead of fruits, would I want you to eat more vegetables? I will keep repeating this until it's clear to you that if you eat a lot of fruits, you are at risk for developing fatty liver, you are at risk for causing yourself to have obesity or diabetes. So eat more vegetables, eat more eggs, and eat fruits occasionally. And if you have diabetes or obesity and you're trying to reverse diabetes or lose weight, do not eat fruits.
Well, it all boils down to eliminating the sugar, and fruits will not be helping you in
That is correct.
Okay, so are fruit juices any better?
If fruits are bad, fruit juices are worse. But if you eat fruits, of course, it takes the body some more time to digest the fruit, and also there's a lot more fiber involved. But if you are actually juicing, where you're not putting in a blender but you're squeezing the juice, you're not getting any fiber at all. Even if you do put in a blender and blend it, you're pulverizing the fiber, and it is not as good at all. So is fruit juice far worse than eating regular fruits? Yes. Eating fruits themselves will put you at risk for diabetes, but if you eliminate fruits and just go for fruit juices, it is going to accelerate the pace of developing diabetes and obesity and fatty liver. So juices, no. Fruits, no. If you're given a choice between juice versus fruit, eat fruit. But if you're given a choice between a fruit and egg, eat eggs, not fruits. I hope I made it clear.
Very clear. Okay, so we're going to move on to the drug of the day, and this week's drug of the day is Metformin. Could you tell us what Metformin is and what it's used for?
Metformin is a drug that is given to patients with diabetes, and if you have diabetes and early onset diabetes, you just developed diabetes in the last few months, the first drug that is given to patients, provided their kidney function is normal, is Metformin. Metformin is a medication that helps the insulin do its job better, so it helps in treating a condition, especially when you have insulin resistance. So for example, if you have diabetes, which is insulin dependency, where you do not have insulin production and you're insulin dependent, then Metformin has no role to play because you are already insulin sensitive to start with. But if you have insulin resistance and you are still making insulin, then Metformin is the first choice of drug which actually helps improve your blood sugar. So once you start on Metformin, you have to be careful because some patients are concerned, if I take Metformin, will it drop my blood sugar too low? Usually Metformin does not drop your blood sugar too low, but in some cases it may. But most of the time, taking Metformin is a relatively safe drug and will not drop your blood sugar too low.
Okay, just like any drug, there's probably side effects. So why don't you go ahead and tell us what those side effects are?
There are some good side effects and some bad side effects. The good side effects are Metformin will actually help you lose weight and improve your blood sugar control. The bad side effects are usually it's GI side effects, that is gastrointestinal side effects. That means you can have bloating, you can have gastritis, you can have diarrhea. So these are the usual symptoms with Metformin. But you also have to be careful. If you have kidney failure or renal insufficiency where your blood creatinine level is high and your kidney function is not normal, then Metformin is not the drug of choice for you. So always follow with your primary care physician. And by the way, everything we discuss here, if you want to implement it, always consult your physician or primary care physician and get their approval before you do anything. This is just for your information purposes only, not for treatment. Having said this, if you are going to go on Metformin, always make sure that you follow with your primary care physician to make sure your kidney function is normal. Now, if you happen to be working in the yard and you don't drink enough water and you decide to take an ibuprofen because your bones are hurting or your joints are hurting, and you take an ibuprofen, you don't drink enough water, your kidney function is already not properly your kidney function is not normal, you decide to take an ibuprofen, what happens? You make your kidney function worse. And at that point, if you're on metformin and you continue taking your metformin, you now have severe side effects of metformin like lactic acidosis, and you'll also have problems where your potassium level will go up significantly higher and you're at risk of dying because of complications of being on metformin. So be very careful. When you take metformin, you have to be well hydrated. If you take metformin and you're not hydrated and you take a pain medication, especially in the form of Motrin or ibuprofen, you're likely to cause damage to the kidney and make the kidney function worse, which in turn would make the metformin drug more toxic. So, yes, it has some good side effects, helps you lose weight. Yes, it also drops your blood sugar. But it can also, in the presence of kidney failure or renal insufficiency or mildly damaged kidney, raise your potassium level and cause lactic acidosis, which could be life-threatening. Another thing you need to be concerned about is if you're planning to go for a cardiac procedure like a cardiac angiogram or any CAT scan where it involves iodinated contrast, that in that scenario, make sure that you are informed. You inform your physician that, hey, I'm on metformin, and if you are on metformin, you have to stop it 48 hours before you go for procedure, and you have to wait for one more day after the procedure is done. In the meantime, you make sure that you are fully hydrated. That's another thing to remember. What are the other problems? If you're an alcoholic, if you have liver disease, you need to be careful. You need to stop your metformin 48 hours before you go for the procedure. So, if you're on certain medications like estrogens, oral contraceptives, if you're on, let's say, diuretics, these medications will raise your blood sugar, so in effect will decrease the efficiency of metformin. So be aware of those things. Especially a lot of people are on diuretics for blood pressure control. Diuretics will raise blood sugar, and if you're taking metformin, you need to consult your physician and say, hey, I am taking a diuretic which is going to raise my blood sugar. I'm on metformin with the intention of dropping my blood sugar, so should I not be off the diuretic and should I not be on another medication that will help me control my blood pressure? So consult with your physician and be aware of the medications you're on and be aware of the interactions and the side effects.
Yeah, so in summary, make sure you don't have any previous medical conditions. Consult with your physician as always.
Correct.
And make sure you're not mixing chemical components which mess everything up.
That is correct. So in summary, please drink water. When you roll out of bed, drink water. Why? Because when you are sleeping for 6 to 8 hours and the night before, if you have eaten something salty and not have consumed enough water, when you wake up in the morning, are you going to be well hydrated or partly dehydrated? You will be partly dehydrated. So if you drink 2 glasses of water, what happens? Even if you make it a point to drink 2 glasses of water and go back to bed for 10-15 minutes, what happens is you'll notice that your mind will wake up, your joint inflammation or aches and pains which you experience will disappear, you're more alert, and you feel good immediately within 10 to 15 minutes after consuming the water. Second is drinking water every time you sit down to eat always helps you in neutralizing the salt in your food. Third is always make sure that you're well hydrated, because if you're not hydrated and you take medications like Motrin or Aleve or ibuprofen, they are going to cause significant damage to your kidney. We also discussed the importance of not eating as many fruits and the importance of eliminating fruits if you have diabetes or obesity and you're trying to lose weight, and not to consume fruit juices instead of water. We also discussed about metformin and what is the role of metformin and why it should be taken and what you need to be aware of. So please be careful if you're on metformin, understand what you need to do and what not to do. Now, having said this, holidays are here. We are in the holiday season, so I want you to watch our previous video on holiday heart syndrome. There's an excellent video on Fox 26 channel which summarizes all the different causes that put you at risk for holiday heart syndrome. Congestive heart failure, stress-related problems, heart attacks, strokes, all the problems which you don't want during holidays. So please join us. 2018 is around the corner and every one of us will have New Year resolutions. So I want you to make it a point to listen to these videos, and in the next few weeks we're going to do more segments on holiday heart syndrome and holidays and heart disease, and holidays and strokes, and holidays and congestive heart failure, holidays and elevated blood pressure.
All right, thank you, Dr. Reddy, for answering the questions. I hope everybody enjoyed this segment. As always, please send us your questions at info@reddycardiology.com. Please follow us on Facebook, Instagram, Twitter, and all our social media platforms to stay up to date with the latest doctor news by Dr. Reddy. We have updates, we have challenges, we have videos, testimonials where people are changing their lives. So definitely follow us. If you have any questions, let us know, and we'll make more videos to address this. Thank you, and have a nice day.
And if you do like us, please send this video to as many people as possible, because we want 1 million people following us on the video newsletter, and I want us all to be involved in this journey. And please shoot us your questions, and we will make it a point to investigate based on the questions you have asked, find and gather more information, and create separate videos for you and post it on the web.
Dr. Reddy's on a mission to make the world a healthier place. Help us help you.
Thank you.